I'd like to introduce Bob. Bob's had a long history of having wounds that have constantly required dressings. In Bob's younger years, he spent many hours at the beach with his skin exposed to the damaging effects of the sun. Unfortunately, this has resulted in Bob constantly needing to see healthcare professionals to have his skin checked, excised, grafted, and even an amputation. Bob's story helps us understand wound care as we see it today.
When I was a young fella, I'd get sores. I'd get in the sun and I'd get a scab on it and it'd heal.
Yeah.
But it don't heal now.
Doesn't heal like it used to, hey?
No.
The old body isn't as good as it used to be.
I'm sure it's not.
Hey? Yeah, that's quite normal. Young people can do that, get out in the sun, pick the scab off and it's all healed up. But as we get older, you know, your blood supply to your legs isn't as good, okay? So your healing ability is diminished, okay?
Oh.
Okay. Now when that scab forms, which we'll probably see, you know, under here, when that scab's formed, like all these, okay, when you're older, all that wound drainage and pus and things can gather under that scab and can cause big problems, okay?
When do you think this wound on my leg will heal?
Oh, look, Bob, it's a surgical wound, so it shouldn't take too long. Look, overall, it just depends on you and your general well-being. You don't smoke, do you?
No, I don't smoke.
No, that's good. Okay, you haven't got diabetes either, have you?
No,
No,
the
good.
only thing I do wrong is have a beer.
Oh, look, a beer every now and then isn't going to hurt too much. Look, it just depends on your overall well-being. So if you don't smoke, you're not diabetic, you haven't got any other major health problems, and you've got a good diet, and you're fairly mobile and active, then it shouldn't take too long to heal.
I'm off to the doctor's next week. Should I ask him for antibiotics to help heal my wound?
No, Bob, this wound doesn't need antibiotics. It's not showing any signs of infection, okay, and we only put people on antibiotics when wounds are infected, okay. The reason that we do that is because we don't want to build up a resistance to those antibiotics.
Can I have a plastic bag over these wounds when I have a shower?
Look, I think that your wound's to the point now where the edges are nice and sealed and it's right to get wet. You don't have tank water? You use town water?
No.
Yep, okay, good. Look, it's fine to shower that wound now, and that'll just help clean your surrounding skin and get rid of any dead skin cells that are on your skin, okay? And I'll be here shortly after you have a shower to pop a fresh dressing on for you.
Years ago, we used to use betadine and Curichrome and Dettol and to use on the wounds. Can they still, is it good to use them now or not?
No, Bob, I wouldn't recommend using it on your wound. Your wound's quite healthy, but if you did actually hurt yourself out in the garden, or you know you had a contaminated wound, then that's when you would use that product, and you'd actually rinse the antiseptic product on your wound, leave it on for about 5 minutes, and then rinse it off. The reason that we rinse it off is because it can actually damage those new cells that are trying to grow there, okay? Some people report that they do get pain with those products as well.
I go to the beach a fair bit, and I'd just like to know whether with my wounds, I've got a lot of wounds, and I was just wondering whether the salt water would be doing those wounds good or not.
Generally we don't recommend going into the ocean because we can't guarantee that you're not going to get some kind of wound infection, especially when you've got an open wound, because there's bacteria and contaminants in the ocean, okay? And those waterborne bacteria are quite difficult to treat.
Will my wounds be infected if I don't dress them every day?
No, Bob, these new modern dressings, they're designed to stay on for up to a week, just depending on the amount of drainage that's coming out. Most people say a week or a leak.
Thank you very much. When the nurse comes, she puts a dressing on it.
Yeah.
In about 3 or 4 days, another nurse will come and puts a different kind of dressing on. Oh, and is that healing my wound or not?
Well, no, Bob. We now know that this is a skin cancer, and and you need to go and see the surgeon and probably have a skin graft put on this wound to get it to heal. But previous to that, when we thought that this wound was healable, the nurses would have been coming out, doing a wound assessment, and then putting a dressing on that they thought was appropriate for that wound at the time. Okay, different dressings do different things.
Thank you.